Hi, and welcome back to Your Life Transformed. I am super excited to talk to Paige Heafy, one of the executives at GYANT, about all the new technologies in AI and what technology can do for patients. So I'm really excited. This is a topic close to my heart. So thank you so much for being on this show, Paige. How are you?
I'm great. It's a pleasure to be here. Thanks so much for having me.
So, for the audience who doesn't know, because honestly, I wasn't as familiar until I started doing research, what is Giant? What is the company that you work for?
Yeah, so Giant is a company that offers AI symptom checking and AI tools that can help facilitate people being able to um, navigate our healthcare system and gain access to our healthcare system in a much more easy and efficient way.
And when did this come out? Like, what did COVID trigger this, like so many other technologies, or was this kind of being done before COVID? And then a follow up question is why? Like, why was this created?
Sure. So this company was actually founded in 2016. We came out with our first product in 2018. So it does predate the
Yeah.
COVID pandemic. The co-founders, their original intention was to be able to essentially level the playing field in healthcare. So to increase access, to
Mm.
reduce the cost of care, and to be able to have patients have better control over their medical decision making process. So they
Interesting.
started with building a AI driven symptom checker that essentially allows people to on their phone or on their computer at home or wherever they are go through the process of assessing what is going on with them. So if their ear aches, if their throat hurts, they can go through a series of AI driven questions in order to help them understand what is likely going on with them and then
Uh-huh.
for them to be able to seek out the right place for care. Now, since the pandemic, right, during the in the pandemic time, a lot of that work was focused on being able to do symptom checking for COVID symptoms,
Correct,
right?
correct,
We
correct.
had a lot of explosion around health systems wanting to offer that in order to be able to navigate patients to the right place, since they did
Yeah,
not want them coming into an urgent care setting or into the doctor setting or into the ED unless it's
correct.
absolutely imperative. So we had a lot of explosion around that, but our core functionality and our core offering around a broader symptom checking capability is still our foundation and is still now what we sell primarily to hospitals and health systems who then make it available to
To
patients in
their
their
patients.
markets.
Okay. That makes sense. So I'm totally into tech and healthcare. I
Yeah, it's the
probably,
future.
yeah, I 100%. So I 100% believe health technology is going to be the future of medicine. I believe this before COVID. And then I feel like
Mm-hmm.
COVID, like, being in this field, like accelerated
Mm-hmm.
all of this, right? Because there were so many hoops with
Absolutely.
insurance and all this other stuff kind of before COVID. And then because we were kind of trapped in our homes, like this was the only way to
Mm-hmm.
communicate with with physicians, with people, with kind of getting all of our stuff met. I even work in the ER, and at one point we were even doing virtual stuff for ER visits, just trying to like
Mm-hmm.
control, you know what I'm saying, the spread of the disease. And so I
Right.
think technology is definitely going to be the way to go. Can you kind of inform the audience a little bit more when you say AI? Like, I know what it is, but how is using AI different in using that in technology different from
Mm-hmm.
somebody just going to Google and looking up their symptoms?
Mm-hmm. Sure. So it is a much smarter, more intelligent way than just going to Google and looking up your symptoms. Because when you're going to Google and looking up your symptoms, Google is just providing you with information in which then you, as a non clinically educated person, are trying to discern and understand and pick up on cues around what might be going on with you. And
And
quite
can I just
often,
add? real
Yeah.
quick. I'm sorry to
Yes.
interrupt, but as the physician, then I see you in my office
Mm-hmm.
or in the ER in the hospital, and you give me the worst of the symptoms that Google picked out. Like, you're
Well,
like, my eye hurts. I may have brain
exactly.
cancer. And I'm like, whoa, whoa, whoa. Okay, sorry. Please
I
continue.
know it's completely true, right? Because typically when you are looking at Google because you have something going on, you are already in kind of a heightened state of like either not feeling well or being anxious. And so you tend to go to like the most worst like diagnosis possible. Like I have cancer or something like that. And I'll even tell like a personal story. Recently, my daughter traveled to South Africa and returned after being there for a month, and she came
Wow.
back with fever and some like a rash on her, and her first thought was, "Mom, I have monkeypox. Mom, I have
Yeah.
monkeypox." And I was like, "No, no,
Yeah.
like go to the
Yeah,
urgent care,
exactly.
get on a telehealth visit, and I am certain
Correct.
you do not have monkeypox." So yes,
Yeah.
we tend to go to like the extremes, or kind of like what we know is like kind of the worst case scenario. So
Correct.
going back to then the use of AI is the smart intelligence. So it will ask you questions around what is going on. And then based upon your response, it is checking your response against an entire data set of hundreds of thousands of people who have been diagnosed with the same issue. And then will, based on your response, will give you then a next set of questions to go down an intelligent kind of clinical line of thinking. So,
Yeah.
right, if you don't have a fever, then it's going to take you down a different line of questioning than if you do have a fever. And
Yeah.
then help you tease out what the true kind of clinical issues maybe that are going on, and then recommend you to either get self-care because it can be managed at home, or to have a telehealth visit or go to urgent care, follow up with your doctor if it is
Okay.
if it is a more serious
Yeah.
condition, or likelihood of a more serious condition, then it will recommend that you go to the emergency room. But part of the goal is to not have people go to the emergency room when it's not necessary,
Correct. I
right?
agree.
It's, as an emergency physician, right,
Correct.
then it doesn't allow you to focus on the people who really have urgent and emergent situations. But then as the consumer, they're getting hit with a really large bill
Yeah.
when it
Correct.
wasn't necessary, because
And is
emergency
that
care
how
is.
this reduces cost then for the patient? So
Yes.
on the patient side,
Yes.
it's almost like
Yes.
having a maybe almost like a nurse, almost like on the other
Yes.
side of this maybe app. Is it an app? And then they just kind of ask questions very similar to what maybe a nurse would do, either in an urgent
Correct.
care or an ER, and then it takes you down this line of questioning. And then, like you said, it's AI. So AI,
Mhm.
unlike Google, is like backed and compared with actual clinical data and clinical pathways that can
Correct.
intelligently kind of offer you, okay, it may be this or this based on everything that you're telling me. And then it makes a recommendation
Mhm.
for the patient. So
Correct. Correct. So
that's
it is.
awesome.
It's almost like replacing, at least as a first line of defense, is like
Yeah,
replacing a nurse or a nurse line,
correct,
because 80% of your basic primary care, urgent care situations like pink eye or strep
correct.
throat can be very simply diagnosed. And
Yep,
this using an AI model and algorithm is a very applicable way in like natural, like next evolution around how we can take care of ourselves,
yeah, correct.
without having to go see a doctor.
Yeah, I agree. I agree. So when I'm on ER call, and I was just on
Hmm.
it yesterday, actually, I mean, people come
Hmm.
in with all kind of, and I'm trying as the physician
Right.
to educate them, like, you don't really need to come to the emergency room for this. You know what I'm
Hmm.
saying? I don't know what happened over
Right.
the years, but I would hear stories of my like grandmother and great grandmother that some egregious stuff when they should have gone to the ER and they just like put some castor oil or whatever
Right,
gin, you know
right,
what I'm saying? And
right.
now like people are like, I had a positive pregnancy test, and we're like, okay, that's not an emergency. What do you know what I'm saying? So I
Yeah, it
like
is
this. Have
true.
you guys seen um actual reduced costs from both the hospital side and the patient side from this system? Like, do you guys have those numbers? Like, have you seen it?
Yeah, so we have. So we've been able to show a reduction in patients not going to the emergency room as needed. We also have shown that we are able to more seamlessly hand them over and direct them to like a telehealth visit or
Right.
to actually, like nowadays some hospitals and health systems have a live chat agent or a live chat nurse, so they can live
Mhm.
chat with the nurse if there's still outstanding questions. So we have been able to see that we are able to more efficiently and effectively navigate them to the right places of care.
Yeah, no, I think that's great. I love this system and I love using AI. I think this is going to be
Yes.
very helpful like in the future. So I guess why aren't you guys like in every hospital system? Like what is the blocker for this? Like if it has this great cost reduction, I think it's great use for the patient. Is it an app? Is that how for the patient side?
So it can reside on a website. It
Okay.
can reside within an app. So it is
Okay.
available in a variety of different places. So it is, but the whole intention, right, is that it's available on your mobile device. So when
Correct.
you're
Easy
on the
accessible.
go and it's easy and accessible, and the majority of individuals in the United States now have some sort of mobile device.
Correct.
And so we're able to extend that out to them to be, like I said, to be able to use 24/7, 365,
Yeah.
in their home or, if they're if they're out and about.
Yeah. Yeah.
Yeah.
And
So,
then to kind of
yeah. So with regards to why isn't it in every hospital and health system yet, it's just a matter of time.
yeah.
They have, the last couple of years, we all have been very focused on just,
Yeah.
addressing the immediate needs around COVID. We were able to spread quite a bit with regards to getting into hospitals and health systems for the COVID support. And so
Yeah.
now we are just continuously, working to expand out further. And, more recently, we've also gone into offering it for health plans because oftentimes
No.
the
Yep.
first point where people go to look for care is their
Yep.
health insurance website because they're looking for providers that are in network versus
Yep.
out of network to manage costs that way. So we're also going into that arena so that way it's also available there. So people can, say I'm sick, they can start that symptom checking process, and
Yeah.
then they can also then be surfaced where to go for care that is within their network, and it's going to be the
Oh,
lowest
that's
cost of
great.
care for them. Yeah.
That's great. That was going to be my next question. Like in the event, like it's not necessarily a primary care issue. What
Mm-hmm.
if it's something like more specific or more? Do you guys essentially just recommend mostly like primary care or urgent care, or do you even get even more specific with the AI where it can tell you based on? I saw some stuff like based on location. I don't know. Can it
Mm-hmm.
recommend a cardiology group or an ENT group? I
Yes.
don't know.
Yes. Yeah.
Okay.
So we have capabilities to extend beyond um, urgent like primary care
Yeah.
diagnosis. That's our core.
Yeah.
But we are able to at least assess. We're able to assess for mental health and behavioral health issues.
Oh,
And
that's
so
good.
if someone comes and uses our tools around self-diagnosis for depression or anxiety, we're able to refer them to behavioral health or mental health
Okay.
resources. We're able to also refer for specialty care. So we can at least do some initial assessment. Like if you
Yeah.
have an orthopedic issue, like think, you're trying to
Like an
understand if
injury or
you broke your,
sprain or
yeah, if you broke your foot or sprained your foot, right? We can
yeah,
do some initial assessment like that and then recommend where you need to go to care, whether you need, if it's likely broken and you really need to go to some place where you can get it x-rayed and cast, or if
correct.
it's just a sprain and you don't need that,
Yeah.
all those
Yeah.
resources. So we're able to at least do some initial assessment and referral around specialty care, mental health issues as well.
Yeah. No, I think that's great. And then it's based on the patient's location, right? So
Yes.
you
So
can,
yes. So we can geolocate you. So if you want to share your location, or if you want to share like a nearby zip code, we can offer where your kind of closest, point of
yeah.
care is. So
Yeah. No, I think that's great. I think this is really good technology. I like love this idea and I can see how it would be so beneficial. And I think a
oh
lot of the
yeah,
technology now is using like what you said, this like AI, which is essentially just a
yes,
smarter technology to help us to help guide people in the right direction so they're just not kind of, all over the place. And I think that's
yes.
where it kind of helps the patient, and it also helps the physician. So, on the physician side, tell me, and I think I know the answer, but I want to hear it from you. How does it help them, and then also
Mhm.
decrease burnout for them? Because that's a big
Sure.
problem.
So, yeah. So it helps with physician workload and burnout in a couple different ways. And I should extend it beyond just physicians, but to healthcare providers, because we actually
Correct.
can help offset and manage workload for all people, in a
Yep.
healthcare setting. So so we do that in a couple ways. First and foremost, if people use the symptom checker and then take the advice as to where to go get care, they are going to the more appropriate place for care. So then people, you as an emergency room physician, you are not seeing the people who don't really need emergency level of care, and you can
Right.
focus your time and attention on the people that really need to be there, right? And so then we are helping to unclog your emergency rooms and move
Yeah.
people to the right place of care. The other way is that we can also, like I said, mentioned previously, we can route people seamlessly for conversations with live chat. And so that can put someone in conversation with a provider via live chat, or via asynchronous, like email,
Hmm.
text communication exchange.
Hmm.
And so that can also help manage the workflow, and again, not necessarily having to see a person in real life in a clinic setting, and
Correct.
that can allow for multiple people, patients, to be kind of managed at the same time. The last way, which we haven't really talked too much about, is that when people use our symptom checker, if it's if they want, and it's set up and configured for the health system to be able to do this, we can actually send over to the healthcare provider a note of everything that the individual has
That was
reported. So
that was going to be my next
yeah, so
question.
yes, so it can, so we can send over a note that has like the history and
Correct.
what their complaints are, and what they are, saying they are experiencing, what they are denying they are experiencing, and then
Yeah.
anything else about their past medical history. And we can send it over so that way it is ready and available if they need to come into the clinic or they need to do a telehealth appointment. The
Right.
healthcare provider can look at that information.
Yeah, no, that's great. Thank you. Because that was actually my
Yeah.
next question. Like,
Yeah.
is like, as the provider on the other side, would I be able to
Mm-hmm.
have access to this information? Because it's much easier because that
Yes.
also saves time,
Mhm.
right? So a lot of times
Yes.
when you come for in-person visits, we have to go through all that in our new patient visit, or sometimes it's pre-filled out and we still have
Mhm.
to kind of review it, or the nurse or one of the staff. but to be able to
Right.
kind of have that sent over electronically that we can quickly kind of review. Many times,
Correct.
like you said, if it's something like common, we're like, oh, that's strep throat. Like we see quick
Exactly.
chat, you need an antibiotic, any allergies to antibiotics, here's your medication, and done. So it becomes like
Correct.
a 5-10 minute visit versus a 30-minute visit. So yeah, no, that was going to be my next question. So I think that's great.
Yes.
That's perfect.
Yes. So we've been really fortunate to one have a medical team, of course, as a part of the
Yeah.
company with a chief medical officer
Yep.
and the members of our clinical team, they are practicing clinicians themselves, so they come with that experience
Yep.
around, oh, let's design it for the healthcare provider and help
Yep.
streamline their workload. And then we also have then our product people who are non-clinicians who can
Yeah.
sit there and put on like the lens of the patient and say, if I'm
Correct.
coming in with no clinical experience and knowledge in education, then hey, how does it feel for me as a patient? And then we can marry up the two to kind of provide the best experience to both.
Yeah, that's perfect. Well,
Yeah.
thank you so much, Paige, for giving us this information. I really think technology is going to be the way to go. I'd like to encourage all the listeners, if you have that option to be able to use technology through your healthcare provider or healthcare system, that's definitely the way to go. As we've discussed here, it helps you navigate a little bit better. It saves you time, saves you money, and then it also helps your provider also. So thank you so much, Paige, for being on the show today.
It's been my pleasure. Thank you.
Thank you.